All right, we are going to get started. So welcome to the Clifton Park Baptist Church Mental Health Symposium, Maintaining Mental Health and Wellness During the COVID-19 Pandemic and Beyond. We are physically located in Silver Spring, but we are virtually online, wherever there is a reliable internet connection. We are under the anointed leadership of Pastor Essentino Lewis Jr. For more information about our ministry, you can go to www.cpbc.net. My name is Cheryl Callahan, and I lead the Clifton Park Health and Wellness Ministry. May is Mental Health Awareness Month, where we are joining the national movement to dispel the myths, fight the stigmas, and support the people and their families who have mental illnesses. It is estimated that 1 in 5 people would experience a mental illness during their lifetime. With the outbreak of COVID-19, many more people are experiencing mental health and emotional dis-ease, ranging from loneliness and anxiety to more serious conditions. During times of crisis, protecting your mental health and your emotional health can help you get through that crisis. So what can we do daily to prioritize our mental health, build resiliency, maintain balance during the COVID-19 pandemic and beyond? Well, we are grateful to have 3 experts in the field who will be discussing what we can do to maintain our mental health and wellness during times of uncertainty like this, and how we might support others who are having mental or emotional challenges. In a moment, I will introduce each of the panelists. When we get started, each panelist will have an opportunity to share on the topic. Once each one has shared, we will have a Q&A session. If you have any questions for the panelists, please note if your question is for a particular panelist and type your question in the Q&A section. I believe it should be at the bottom of your screen. And please, if you type your question in the chat box, know that we may not see it. We'll do our best to check to see if there are questions there, but it would be great if you can type them in the Q&A section. So we thank you for your presence, and let's take a moment to open up in a word of prayer, and we'll get started. So let's look to the Lord. So gracious Father, we pause to bow in your presence. We are physically separate, but we are connected by your Spirit. We are physically separated, but you are here. We feel your presence. We know that you are present. And we are knowing that you are working in this season of separation, physically, but yet we seek to remain spiritually, mentally. Your word tells us that there is a time for everything. To everything there is a season, a time for every purpose under heaven. And we know that this is a season which while you may not have established in your perfect will, you have allowed it. And as we go through this out physically well, and emotionally, spiritually, and mentally well too. So to ourselves, to maintain balance, to maintain our mental and emotional health. We open our hearts to you that we might hear you speaking. We're thankful for the panelists that you've given to us to speak on this topic. May you use them for your glory, and may each of us have something that we can take away from this conversation. Let it be healing to our souls. And so we commit this time into your hands. In Jesus' name we pray. Amen.
My name is Lynval Williams. I'm one of the chaplains at Shady Grove Medical Center. I work primarily with our behavioral health patient, at least for the last 2 years. And I am passionate about what I do. I feel like my calling was generated in a way where that the text in Matthew that says the least of these. And I felt like most times mental health people are, you know, technically pushed on the curve and they become the least of these. But in so much, you know, I've learned just by working here and having the ability to reason with people that helps me get rid of a lot of stigmas and stuff that I personally had and how I viewed people who are struggling with mental health. So I am elated to be here tonight and to serve with Sharon and Jessica. I appreciate the opportunity for this. Thank you.
Hello, everyone. Thank you, Lynval, for starting this off. I am Sharon J. Lawrence, and I am a licensed clinical social worker. I have a practice in Largo, Maryland called SELA Wellness and Therapeutic Services, where I provide therapy to other therapists and professionals as well as couples. I also do anger management groups for adults who are court mandated and non-mandated. I have been in the field for about 20 years, but my private practice as of today is celebrating my 3rd anniversary in providing therapy for adults only. But over the past 20 years, I've been able to work in the areas of foster care, behavioral health, juvenile justice, just a number of areas. And so I'm hoping tonight to be able to share what my 3-year mission has been thus far, and that is making sure that people are balancing well and that they're taking care of themselves so that they can better serve others. And so I'm really excited as well to be with you this evening, and I'm looking forward to connecting through the Q&A as well.
All right, good evening, everybody. I'm Pastor Lewis. I was not expecting to be moderating this panel tonight, but sometimes you've got to jump in when you have to jump in. So I do want to thank all of you for agreeing to share with us tonight. And I see you all have gotten started. And so that's, I think, the way we would start. So Lynval and Sharon, thank you for introducing yourselves. And Jessica, would you mind kind of just giving us a brief introduction, and we'll kind of make our way through this the best we can.
Sure. So good evening, everyone. My name is Jessica Young Brown. I'm a licensed clinical psychologist in part-time private practice in the state of Virginia. And I also teach at the Samuel DeWitt Proctor School of Theology in the areas of Christian education and formation. So my work is really kind of at the intersections of faith and mental health, helping people to think about how their faith informs the way they understand their mental health symptoms, how we can use faith as a coping mechanism and a process for healing. And I also recently published a book on faith and mental health called Making Space at the Well, which provides churches with some practical resources around how to minister to folks across the spectrum of mental health symptoms.
Excellent, excellent. So, well, again, thank you all for joining us this evening, and as well thanking all the people who have dialed in to watch the symposium. And I mean, obviously, we're kind of gathering this evening because we're in this kind of critical moment, right? And so, as I have been pastoring people and kind of checking in with how they're doing, there's a broad kind of spectrum of responses and feelings that people have in this moment. This is a season, I think, that none of us have really lived through before. And so if I can, I guess, start by just asking a general question, and you all can take it in any order that you feel led to. But is there any kind of just general advice that you would give people as they're seeking to kind of process this moment? And I recognize people will process it differently, but are there any general thoughts you have about just kind of processing what this moment means in terms of our overall health and wellness? Sharon, why don't you, yeah.
Yeah, I was gonna.
Yeah, you look
So
like
what I
you're
would-
shaking your head.
Yeah, because this is my third event this week that I've been sharing online. And so one of the things that I have been encouraging people to do is to really be okay with sitting with what you're feeling. You know, don't try to run away from it. Don't try to avoid it. What is happening right now is critical and it's traumatic for a lot of people. Many people are grieving what they consider to be their normal routines in their lives and the ability to just socialize with one another. And so for my clients and for my students, I'm encouraging them to be okay with sitting with where you are and be okay with grieving and be okay with being disappointed in, you know, canceled weddings and canceled engagements and all those things and proms and graduations, right? And so much has happened. But I would say sit there for a minute and acknowledge what you feel in that moment and be okay with being disappointed and hurt and saddened by it. It is a major adjustment. For some people, they're like, oh, this is a rest time. It hasn't quite clicked yet. But for some people, it happened very instantly. Yeah. And for them, it was very depressing. And so I don't want to say too much because I know I have two other amazing panelists, but that would be my first thing. Be okay with just sitting with it for a minute before even trying to fully adjust to what's happening.
Yeah, I was in a conference, and I'm coming, I guess, to you, Jessica. I was in a conference just today, and one of the presenters was talking about what we need in this moment is not necessarily just positivity, but optimism, right? Understanding that positivity is kind of seeing the world through rose-colored glasses as if nothing is happening in the moment, whereas optimism kind of sees the darkness, but also looks with hope towards the light at the end of the tunnel. And so that's kind of reminiscent, I think, of what you've just shared. Jessica, you want to jump in?
Sure, I would add to that. You know, there's related to what you were talking about, there's been this language going around about the problem with toxic positivity, right? Which is exactly what you're talking about. This focus on the positive in a way that kind of ignores the reality. And my mantra, similar to Sharon, has been, it's okay not to be okay. You know, we've never experienced this before. I don't have a blueprint for how to switch my classes online in the middle of the semester and try to teach to people who are dealing with a diagnosis or have a family member who's passed away, right? And so I think it's really also about extending grace to ourselves and to others, right? Our productivity levels aren't going to be the same. We won't feel happy and energetic all the time. And so some of it, I think, is just around managing our expectations that this isn't just as simple as, oh, now we're working from home. No, we're trying to survive a pandemic and having to work from home so that we can earn a living and support ourselves. That's very different. And I think it's important to just key into that distinction and honor the difficulty in this moment, even for those of us who are privileged in many ways.
Yeah, great. Lynval?
Yes, if I could follow up with that, I guess both of them have pretty much summed it up, but I say it this way: don't be afraid to give permission to your emotions. It's so important that because giving that permission helps you to understand what's actually happening to you. So you can't fix something if you don't know what's going on. And when we try to, and that's pretty much what happens sometimes with mental health, people suppress it, they hide it, and over time, it's like a bottle that you shake with a Pepsi bottle or something, and it the pressure cannot hold anymore, and it just blow out of proportion. So give permission to your emotions for them to run their course.
Excellent. So I see, Cheryl, you're back. You got to take yourself off mute. You good?
Yes, sorry about that. I hope this is better. I still see it's unstable.
So look, I'm going to just hang out here while you're doing this. And if I need to jump back in, I'll do that.
Yeah, no, appreciate it. I'm so annoyed because I've been on Zoom all day. And as soon as this starts, my internet connection gets unstable. But I'm certainly grateful for this opportunity. I'm grateful that you jumped in, Pastor.
Yeah.
So I was listening to the conversation as I was getting reoriented here. And I appreciate what you all are saying about just giving yourselves permission. to be still and to feel what you feel. I want to ask you if you all can speak to kind of the issue of mental health and faith, because I think sometimes in the faith community and even in the African American community, there are some myths, some stigmas, there's some shame around the topic of mental health or emotional health. So are there some things that you would want us to know, or the church in particular to know or do in regards to that?
So I can start with that one. I think the main issue for us to realize when we're talking about faith and mental health is that mental health is equally as important as all the other aspects of health that we think about. So in the church, we are experts at spiritual health, right? We teach people prayer. We teach people how to study the Bible. We teach people the importance of engaging in community. We've gotten better at teaching people about their physical health. So we talk about heart health, and we have baked chicken in addition to the fried chicken after church, right? And so we do those kinds of things to try to manage physical health. I think mental health is often more stigmatized because it's not as visible, it's not as tangible. And frankly, we as Black folks, particularly in this country, have been through so much that we've become accustomed to just pushing through and not talking about those emotional struggles that we face. And so I think it's important for us to pray and to seek God for our healing, but also to act. And that means having resources available. It means having those professionals like those of us who are here who can guide people through that process and not divorce them from their faith. I think it also means normalizing what we were just talking about, which is having a space to not be okay. And that doesn't diminish who we are as believers or as people, but in fact, it has the opportunity to connect us, because the reality is we all have experiences where we're not okay. And it's a moment that can actually join us together in terms of, instead of separating us.
Now, Sharon, you look like you had something to say as well.
I was just agreeing. I'm
Okay.
ready now if you want me to.
Yeah, okay.
I can help
That's
you.
fine. So all of us have been making adjustments to our daily routines as a result of the sheltering in place. And one thing, there are people who may live alone, or just people who are feeling isolated, disconnected, or lonely. So what can we do to prevent these feelings of loneliness, despair, or hopelessness? Or even triggering some underlying mental illnesses that may not have been diagnosed.
Cheryl, just before I speak to that, can I speak a little bit more about faith and mental health?
Sure.
I feel like that's a huge thing right now. Over, I'd say the past 3 years or so on, I've been engulfed in, doing like symposiums like these, or pretty much doing mental health trainings, because I'm a trained mental health first aider.
Mm-hmm.
And I just want to say this: people who serve God still have mental health.
Mm-hmm.
I just want that to sink in for a little bit. And it's not because you're so bad, or it's not because of something grandma did that's reflecting upon you now, or something you may have done in the past. But mental health, as was said clearly, is one of those illnesses that we deal with and we don't usually see as often as we do. So, for instance, in our hospital, our mission, I call it a three-legged dog, right? We demonstrate, or we extend God's care through the ministry of physical, mental, and spiritual healing. Mm-hmm. Without the three combining, when we talk about mental wellness, that cannot happen if all three of those things doesn't combine together. And so as a mission-driven person, I believe it's important to let people know that our mental health is equally important as any of the other legs of the process. And we have to pay attention to it. So God doesn't, I've backed in with so many questions every day. The first is this existential question as to why me? Why is God allowing this to happen to me? Not my brother, not my sister. I've got those questions. And my job as a chaplain always is to not answer those questions, but throw back those questions to these people and help them literally process what that really means for them. And umpteen times I will get that response. You know what, chaplain, you're correct. I didn't say anything. I just help them to reflect. And through their reflection, they understand that what's happening to them has nothing to do with God, but the sickness that is here, right here and now. So, there's a lot of us who talk about faith from the perspective of, if you have a mental illness. Couple months ago, my pastor had a physical ailment, right, where he was limping. And people go up to him and ask him, listen, what did you do wrong? So we saw these things like in Job's situation, like his friends battled down on him, like, what did you do wrong? You have to do something wrong. Why God placed this thing on you? So I just want to make it very clear that this is a myth that Christians don't have mental health. No, we do, because it's a part of our well-being. I'm sorry, Cheryl.
Yeah. I did want to add, I think it is important, since you asked that question, Cheryl, is that people understand that there is a difference between mental health and mental illness. Just like everyone, has physical health, not everyone has a physical illness. The same with everyone has mental health. And so we know 1 in 5 are impacted by mental illness. And so I want to make sure people understand that there is a difference. A lot of times those terms are used interchangeably, but they mean 2 different things. Yeah. And so I wanted to make sure they understood that it doesn't mean that something's wrong with you. It means that you are now faced with something that has to be addressed so that you can move towards improving the quality of your mental health. And so that is the goal. I think Dr. Jessica put it, is that, it's equally important. And so when it comes to that faith, component, you're okay with integrating faith into your mental health journey. And so when you find that clinician or that psychiatrist, you can let them know that that is a very important part of your life. It doesn't mean that you addressing your mental health cancels out your faith. And so please be mindful of that. I always tell individuals when they come to me, the first thing they will ask is, what does Sailor mean? And I let them know it means to pause and to meditate on what you just heard or read. And so they say, well, why'd you name it that? Because when you come here, you're going to pause and think about where you are and what's happening, and then what that next step is. Yeah. And so you don't get to just jump right to the end. And I remind them that throughout the Bible, kings had wise counsel. And so if you must, consider us wise counsel, and allow us to help you on that journey. Dr. Anita Phillips says something that I felt was very powerful. She says, prayer is a weapon, but therapy is a strategy. And so when you bring those 2 things together, I just think you have a recipe that really helps you move towards success.
Amen. Amen. So thank you for bringing that point out, because I do think we often conflate the 2, mental health and mental illness. And if someone has a mental illness, we think that there is something wrong. But if someone has cancer, we treat that illness differently a lot of times than we do someone with mental illness. So even as we think about kind of our mental health, one of the things I've heard you say was talking about giving yourself permission. We've put together, and I think it should be in the chat, a link to a document that we're calling Mental and Emotional PPE. So just as during the coronavirus, with the medical professionals, they're having to wear certain protective gear. So we're thinking that there are some protections that we should be doing for ourselves as we, hunker down, we shelter in place, we do the physical distancing. So we wanted to, share that with people, but I would like to give you all the opportunity to share more about some things that we can do, even if we're not dealing with a mental illness, but we want to be well. We want to emerge from this experience of this season well and mentally well. So, and we talk about these virtual connections and different things, but what are some of the other things that in your mind we can do so that we emerge from this mentally well, mentally strong?
One of the things that I would encourage people to do is this is a time of reset and reflection. And so if there are some things that have been on your mind to do, maybe this is a time to start it. You know, if it's reconnecting with others, if it's writing that book, if it's journaling, if it's working on projects that you may have at home, if it's using that time to kind of connect with family members, really trying to understand who they are and how they feel about what's happening and what they hope to accomplish once we come, you know, out of this, because we will come out of this, and allowing yourself to kind of just do something new, being able to pivot pretty much. I think that's the biggest thing, and that's the word that a lot of people have been using, is to be able to shift and allow yourself to be flexible, to try some new things or begin some things that maybe you allowed to fall by the wayside. So I would encourage people to kind of just, you know, start some movement with some things that you may want to do, or even physically get out and get some fresh air and, you know, try that new recipe. I mean, I made fried chicken in the air fryer today and I was really impressed. I may not drop the chicken in the grease again. No, I will drop it in the grease again. So, Dr. Jessica, I will have the air fry and the regular fried chicken.
You need options. Exactly. That's all.
But it was really good.
Yeah. Yeah.
I would add, oh, go ahead, Lynval.
Go ahead. No, please, go ahead, Jessica.
Since you mentioned the body, Sharon, I think taking care of our bodies during this time is so important. We often underestimate both the stress we're under at any given time and the impact that stress is having on your body. So when you're under stress, and we're all under stress right now because of what's going on in the world, your body releases a chemical called cortisol that is really great if you need to run from a fire or run from a bear or lift a car off of your child. But it's really bad if you're just sitting around living your daily life. It really damages your body. And so many of us are starting to feel those physical effects of stress: trouble sleeping, trouble with digestive problems, trouble with memory, trouble with concentration. And there are so many things in this moment that we can't control, but what we can do is take care of our bodies. We can try to exercise. We can make sure that we're getting good sleep. Even if you can't get high impact exercise in, you can do some stretching, some meditation. Those kinds of things really help to manage the overall level of stress in our bodies and help us to cope better during times like this.
I want to speak to that from the perspective of an advance. Do you know what an advance directive is? I'm talking to the listeners. You know, an advance directive is, you know, kind of like one of those things you get in the hospital just in case you're not able to make it, right? Someone can speak on your behalf. A lot of times we don't have the support system. And the beauty about mental health, you know, when I think about mental health, really, I think about it like the gospel, right? The gospel, we say it's the good news, right? Mm-hmm. It's the good news, right? You tell this good news and people hear it and they're accepting it. So is mental health. And why is it good news? It's because recovery is possible in it. Most people don't know that this is possible. Now, when I talk about advanced directive, I'm talking about it from the perspective of how many of us really think of a spiritual advanced directive? In other words, when you're unable to hope for yourself, someone can actually carry your hope for you. Right? So if you can't hope, because, you know, a lot of times when you're in a ditch, when people are in a dark place, if I use that terminology, you can't help yourself. And the people who you're expecting to help may not be able to help you, like for instance, your wife or your husband, the people closest to you, because they don't know how to. And the way they're helping you was never helpful anyhow. But you have made that decision to help them to understand what can be helpful to you and how they should help you. So I always tell my patients, why don't you create an advanced spiritual advanced directive? Maybe it's not God, right? Maybe it's a dog. But how do you find the connection between that thing that helps you to pull through this when you don't have the hope to pull yourself through? Okay.
Cheryl, can I jump in here?
Yeah.
And so to your point, I'm wondering if you all can speak to the importance of community in this season. I think one of the, I guess, intrinsic issues with social distancing is this feeling of isolation. And I think that isolation becomes even more acute depending on what your kind of status in life is, right? So if you've got a house full of people, sometimes you can feel a little bit more community in there, but if you are by yourself, there's a certain other set of emotions that you feel. And so even as you're talking about this notion of advanced directive and being able to assign or allow someone to help you to kind of pull through these situations, I'm wondering if you can speak to just the importance of community. And I ask that as someone who leads community. And so if you could speak to that.
I'll say that one of the biggest thing I've seen right around this time, well, there are a couple of things. Anxiety is big, depression is big, and they're like sisters. They pretty much run close together. And I also realize that there's a lot of drinking, problem drinking, they call it now. And oftentimes with isolation, that breeds, that's like depression thrives on this, right? So in this time, we're not necessarily asking you to socially distance yourself, but to physically distance yourself. And so one of the things I talk about is, maybe it's important for you to, at this time, figure out how do you guys have dinner together, right? How do you have dinner together? I was talking to my pastor, we talk about communion. We can't go to church and have communion. We can't go to church and have, we call it dinner, fellowship dinner together. But I said, what about we making our own food? And at lunchtime, after break, after we break from the service, we all sit down and kind of talk about what we're eating. What did we make? How, kind of a stuff like that. So we might be physically distant, but we don't have to be socially disconnected.
Mm-hmm. Yeah, that's a great point, and I do like the idea of the spiritual advanced directive, because God's word tells us to bear one another's burdens, and that's a demonstration of our love for one another. So certainly, when someone is emotionally challenged or mentally challenged, we can show love by doing that, and I like that. I like that idea. I may have to use that involved. So we have a couple of questions in the Q&A. The first question says, I was diagnosed with bipolar after a suicide attempt in 2017. Since then, I've been through a lot of different medications. How does the panel feel about medications, and how do I cope with the process of finding the right thing to help me stay at baseline?
I am for medication. I'm also for having options if you feel like you do not want to go that route and you want something more natural. I always encourage my clients to, whatever path they take, to speak with either their primary care physician to make sure that there's no other issues going on before they try something, but also speaking with a licensed psychiatrist, someone who knows really about psychiatric medication before just trying something. and not just going in and saying, hey, I have this issue, what should I take? But being able to say, okay, what does this mean? Is this long-term? Can I start at the lowest dosage? Really understanding that it should be a dialogue. And so I think when it comes to medication, sometimes for some people, they may get that one medication and it works the first time and they're like, I got what I needed, I'm good to go, I'm feeling much better. And then there are some people where you may find that you are trying several medications because the first one didn't work, the second one didn't work. And so my encouragement is to don't stop, don't stop. And if you feel like you are having side effects or reaction to the medication, also don't just stop. Speak to the doctor immediately and talk to them about that. One of the things that we are finding right now in this time is that while people are at home, there are a ton of people who are saying, oh, well, I'm at home, I can stop my medication. Or we're at home, I'm going to take my son or my daughter off of this medication. And we're encouraging people not to stop their medication during this time because you still do have to interact with your boss or your family members. And if this is something that assists you in being able to manage your symptoms, please do not stop your medication. It is part of your day-to-day process. And if you choose to decrease, have that discussion again with your psychiatrist and do it the right way so that you can wean off gradually.
Thank you.
Yeah, and I would just add to that with many of those medications for mental health conditions, it can take 4 to 6 weeks sometimes for it to get into your system and be effective. So if you decide to stop that prematurely, or you think you don't need it on certain days, you're actually interrupting the medication's ability to have its full effectiveness for you. The other thing to think about is some folks need medications. Some folks need medications and a therapist, whether that's group therapy or individual therapy or whatever the case may be. And so it may be important to think about kind of a combination approach. The medications will help with adjusting the brain chemistry. The therapy helps with adjusting your relationships, helping you to build new skills, and helping you to feel like you're overall more competent in terms of managing things that you're dealing with.
Thank you. Another question from the audience. As folks are in or emerging from social isolation, can you talk about some warning signs of lingering or emerging mental health concerns?
If I look, for instance, at, say, depression, anxiety, depression, both works hand in hand, as I said before. Physically, you can look at fatigue. So people can get fatigue, right? I'm going to just list out some of what I have here. And you guys can agree with me or not, all right?
So Lynval, are you going to talk about some of the warning signs or tips, like how to recognize?
Yes, so
that'd be good.
technically, we look at it from 3 perspectives, from the physical, the behavioral, and the psychological. So from the physical, we talk about fatigue. Sleeping too much or sleeping too little, you can find people doing that. Overeating, or probably under-eating, if there's such a word. You're doing less eating. Headaches, you might find headaches and stuff that you never usually have as regular, and this becomes a regular headache. From the behavioral health side, this is where you have the crying. Am I correct? Mm-hmm. Yes. Okay. The crying, the neglects of responsibilities, like loss of interest in personal appearance, and this is a big one where people don't want to shower, people don't want to brush their teeth, people don't want to fix their hair. They're going to work, but you're looking, these things happen. In my mental health class, there are videos that we show and treat, to help people understand what's happening with people. And from the psychological, and there's much more, but from the psychological part, there is now like sadness, right? To deep grief of sadness, anxiety, guilt, anger, mood swings. And my one I have to put there is spiritual deficiencies. So you'll have people who just say, God doesn't want to hear from me. I don't want to read the Bible anymore. I don't want to go to church. Church doesn't do anything for me. The walks I used to take doesn't do anything for me anymore, and stuff like that. So I believe that those are some of the signs. I leave the others to talk a little more about.
I think you covered most of, I mean, the basic of what, you know, we normally find as the common behaviors in those areas, or the symptoms, if you will. One of the things I recently told my students was that I said, I'm going to need you to open up the windows and let some fresh air come in. I need you to change the sheets on your bed. I need you to do your laundry. I need you to get up and shower. Because if I have to show up looking like this, so do you. And so, you know, I want to make sure that there is some normalcy, right? But we understand that there are individuals who may be struggling and are very symptomatic. And so those are some of the things, but a lot of times you're going to see some type of change in their behavior.
Yeah, and that's a great point, and it kind of segues into another question that I have is about the children, and I think you're probably referring to college students, but what would you say to parents or caregivers who are dealing with children of all ages? We know some college students are missing their graduation, or they're missing just kind of their autonomy because they're back at home with their parents. So what would you say to parents to help their children navigate this?
So when we're talking about smaller kids, I think one of the main things to think about is kids are having the same feelings that we as adults are feeling. They just don't always have the language and the skills to talk about those feelings in ways that we would consider acceptable or productive. So many parents at this point, you know, I think similar to you all in Maryland, here in Virginia, we're entering like week 6 or 7 of sheltering in place. And so you're going to see kids acting out, kids talking back, kids throwing tantrums, those kinds of things. Your kids are not just trying to get on your nerves for the sake of it. What they're communicating to you is, Mom, Dad, caregiver, I am not okay. I need your help. Right? And so they need to talk about this too. Even young kids, right? My son is 4. He doesn't understand all the intricacies of what's happening, but he knows he's been out of school for 5 weeks. He knows that he's been at home a lot with mommy and daddy, right? And so we've had to have conversations with him about, here's why we're doing this. Here's why we think it will keep us safe. We've had lots of nightmares about monsters and about aliens, right? And that's his way of processing it. And so, as we said at the top of this experience, right, all of us, no matter how big or small we are, need those opportunities to talk about what's happening, or even to say, I miss my friends, I miss school, this is different, right? When as parents, we can help by trying to keep a routine in place. It helps with anxiety if we have some predictability in our day. And so you don't have to schedule in 30-minute segments, but if there can be some predictability in terms of what's going to happen from day to day, that can also help. As we get to our older kids, again, it's just acknowledging the loss, right? Think about high school graduates who won't have a high school graduation. Really sitting and talking to them about, you still had this big accomplishment. This is still something you've been able to do. Can we as a family talk about how to commemorate that and celebrate you, even if it's not the way you intended it to be?
If I can ask a question to follow up, and so Jessica, so if I'm watching this symposium, and I know that I'm feeling some things, how do I know that if those feelings rise to the level of me needing to speak to someone about it, or whether it's something that I can navigate myself? I feel like there are a lot of people that are feeling emotions that perhaps they've never felt before, and that's primarily because we're in a moment that we've never been in before, right? And so they get into this moment or this cycle where they're saying to themselves, well, maybe I can just press through this, or maybe but how would one know that there's something that's quote unquote wrong, or something that needs a kind of a little bit deeper kind of exploration than what one can do on their own?
So I'm sure others have reflections on this question as well, but I am a firm believer that all of us need therapy. And so I think, just as a general rule, if at any point you start to have concerns that you are not managing things well, that things feel overwhelming, or that you need help, even if you feel like you're doing okay, but you feel like you could be doing better, that's a reason to go. That's a reason to check it out. And as mental health professionals, one of the things that we do in that initial session is ask you questions, get to know you, get to know what you would like to see different in your life, and then really just have a conversation with you about, okay, here's what I think is going on. Here's how I think therapy can be helpful. And so I've had people who come to that first session and say just what you've said. I don't really know if I need to be here, but something just doesn't feel right, so I just want to check it out with you. That's a great reason to go. It really is. And I think, if you're kind of engaging in the things you normally do, checking in with your friends, taking care of your body, engaging your spiritual disciplines, and you still don't feel at your best, that's a reason to go and seek help. It's never going to hurt to go get a mental health checkup, just as it never hurts you to go get your yearly physical at your primary care physician.
Yeah. And kind of to segue on Pastor's question, there are these online mental health screening tools. Can each of you or whoever is led to speak on them, and is that something that lay people should use? I am a lawyer by training, and I always get questions about people wanting to use online forms to do legal work, and I'm always, cringing when I hear someone wanting to do this. I'd be interested to hear your take on the use of these online mental health screening tools. I think Mental Health America has several that's on their website, and I think I've seen something on the Lighthouse Project or Columbia Project that has them. So can you speak to those tools?
So when you think of Mental Health America and all those other sites, they are credible. And a lot of times they're putting things up that are part of the criteria for the DSM-5, which is this huge book that we all use to diagnose everyone. And so when they're doing that, what they're pretty much doing is saying, hey, these are a couple of things that you can kind of look at to see if, you're experiencing that. They're not saying, hey, if you have these things, you definitely have it. Some things are situational for individuals where they may feel it in a moment, depending on maybe they had a disrupted friendship and they were depressed for a couple of days and it passed. But for someone who has symptoms that are lasting 3, 4 to 6 weeks and they just cannot shake it, just like Dr. Jessica was saying, like when it's lingering, it's almost as if when something's not right and you have to investigate, and so you're on this mission to solve this crime or this wrong that has been done. That's exactly what happens with symptoms. They kind of stick around, and for some reason you can't shake it, and so that's a reason to go and investigate and figure out what it is that's happening with you. And like Dr. Jessica was saying, you don't have to wait until, you're fully symptomatic. I tell people, be preventive. I am a therapist for therapists, but I'm also a therapist with a therapist. And so even during this time, I have to utilize my own therapist to say, hey, I need to process because there's a lot going on and this has been a major transition. And so if you're finding a screening tool and the fact that you're even taking the time to read through it, I applaud you for not being afraid to even read it and say, hey, let me do this self-check and see if I'm in any of these areas, and then making that next step to connect with a clinician.
If I hear you correctly, Sharon, what I'm hearing is that you're not diagnosing yourself. You're just literally checking these things and then go to the professional for the help. So it's not like you're, okay, I have this, okay, so I'm this. Because that's pretty much, I think, what will happen sometimes. Mm-hmm. You do all of these checks and then you're ultimately this. But the reality is, no, you need to go talk with someone, because a lot of these things are situational as well. It could be something that you're going through at the moment and you need to just shake that off.
And the reality is, some people have been having symptoms for so long that they've almost become accustomed to them, and they don't realize it's a symptom. They think that's just the way it is. There's a particular type of depression that's like a low grade, long term depression. And often you have people who come in with that form of depression and think it's just their personality because they've been dealing with the symptoms for so long. And so those screening instruments can be helpful too in just enlightening people to the fact that, you know, your life could be different. It could be better. It doesn't.
Yeah, if I could just chime in one more time, and I think all of you have spoken to this as part of your earlier presentations, but I think it's important to just put a finer point on it as well, and to say that as we're talking about holistic wellness, you know, mental health and physical health and spiritual health all kind of coalesce together in order for us to be whole and complete people. And so even as we might feel like there's some type of issue, or we might be feeling some challenge in a moment, as we're thinking about these assessments, Cheryl, and as we're thinking about how we're identifying what the problem is, I think it's important that we are kind of checking the boxes on the complete person that the Lord has made us, right? So as he's created us as unified beings, we should be checking in on our mental wellness, but our physical wellness as well, and certainly our spiritual wellness. And so all of those kind of impact each other. And I know that we've all said that, but I do want to say it again, as you know, we may be talking to people that are just feeling a little off. I think there are just different boxes to check as we're assessing what that looks like and what might be the origination of that.
Yeah. I mean, that's certainly true. Looking at our wellness from an integrative perspective, that God didn't just create us with a mind or just a body, but he gave us all three, the mind, body, and the spirit. So I mentioned the mental and emotional health PPE document that was, I think it's in the beginning of the chat. If you click on that link, you can download it, and you'll see that it speaks to those three parts of us in terms of the spiritual, the physical, the mental, and the emotional. So as we look at our wellness, there are some things that we can do ourselves to be well, as well as when it's appropriate, seeking professional help. And there's another question in the Q&A that asks if we can speak a little more to the difference between just mental health and mental illness. And I think, Ms. Sharon, you talked about that a little bit, but the question is coming up again, that people want to wrestle with, okay, mental health versus mental illness. So if we can speak to that again.
Can I just read, sorry, did you want to go, Sharon?
No, go ahead.
I'll just read what the mental health first aid teaches on that. It says, where am I? So, and I love to make this distinction because, you know, if you guys are in DC, you'll know how crazy the roads are in DC. Like nothing is horizontal. It's like more vertical roads, you know. And so you're at a stoplight and you don't really know, is this stoplight is for you? I know that happens to me, right? So one morning I was leaving my house and to do a training in DC, and I put in my GPS and it left me in the middle of a road. Like, okay, the building is here, and I'm looking around, I'm like, there's no building, right? Something is happening to me, right? And that's what like a mental problem is, right? Because it's not something that is diagnosable, but it's something that you feel on an everyday situation. Mental health, as it says, can be conceptualized as a state of well-being in which the individual realizes his or her own ability, one, can cope with the normal stresses of life, can work productively and faithfully, and is able to contribute to his or her community. That's what a mental health is. Now, think about stuff happening outside of that. That's where the mental illness is. Like, for instance, if you're not able to work, do your daily activities, engage in satisfying relationship, things like this. This is what creates the mental health problem. And with these classes, you get to show videos and stuff like that that speak specifically to these situations. So I'm also encouraging you guys to take the mental health class.
So, Ms. Sharon, were you going to say something on that as well?
That was the definition, and that was the main thing. That was what I was going to do, is just read the definition so that they can understand the two different dimensions that they are. One is on one side of the dimension and one is on the other. And one is showing how healthy things are and how you see things and how you're experiencing things. But the other one shows the disruption in functioning and the ability to have a healthy walk in terms of your mental health.
Okay.
I'm sorry. I know I'm not supposed to be moderating this. I do have a question. I'm sorry. I guess that's the problem with having a pastor on the call. But Jessica, I wonder. I want you to speak more to your statement that everyone needs a therapist. I think it's an important statement. And so I won't add any more commentary to it. I'll just let you answer it.
Okay, so the reason I say that, and call me biased, it keeps my profession alive, but the reason I say that is because therapy is the only time in your life that you get the majority of an hour dedicated to you with somebody who cares about you, but who you don't owe anything to, and both you and that other person are committed to you being the best version of yourself. In every other relationship that we have in our lives, those relationships, hopefully, if they're healthy, are reciprocal in nature. And so the chance that you would get that amount of time just laser focused on you and being the best that you can be is slim to none, even in the best of relationships. And so it's an opportunity to, number one, say the things that maybe you don't feel comfortable saying to anybody else in your life. But number two, to dissect, to be curious about, to sit with patterns in your relationships, patterns in your thinking, patterns in your ways of understanding yourself that shape how you show up in the world. I think it is a true gift to be able to have that experience and to have it in your life on a daily basis. And to be frank, because so many of us are so busy doing all the different things that we do, we don't often take the time to introspect in that way, to think about ourselves and to look at ourselves. And so therapy provides us an opportunity to do that with the person who really cares about you, but who you don't have to interact with anywhere else in your life, which is a great combination. So I think it can be helpful to everyone. I think it's also important to normalize that. Sharon mentioned earlier that 1 in 5 adults will meet criteria for a diagnosable mental health condition. Those are just the statistics, and that's probably an underrepresentation based upon what we know about how those statistics are gathered. That's mental illness, right? A diagnosable condition. The rest of us, even if we don't meet diagnostic criteria, at some point in our lives, we have symptoms. At some point in our lives, we feel like, I don't have it all together. Things aren't making sense for me. I don't feel like my life is flowing. And so I strongly believe that in those moments, it can be helpful to have someone who walks with us and who bears witness to that. Now, that can happen in other places too, but the benefit of doing it in therapy is that you have someone who is skilled, educated, and professionally qualified to not give you advice, because we actually don't give that much advice, but really to sit with you and help guide you, as Lynval said earlier, to discover the answers that are already inside of you.
to add to that, Jess, it's also not to judge you. So there's no judgment. Whereas where you have this reciprocal thing, it's like you get this, you give that, but this is no judgment. So when we see people, it's not like we have an outcome as what the session is supposed to be. No, you're there to just be you and not feel judged.
So that's a great point. And as we are, most of us, I believe, on this call are people of faith. The question that's come up is how do you go about finding a reputable Christian therapist?
There are several sites that are out there. One site that I often will refer to is Psychology Today because of the filter. I have to say that that's how I found my therapist. That's how 95% of my clients found me, and also by word of mouth. It's also helpful. You can ask someone, hey, do you have a recommendation? You can ask your primary care physician. And then also, depending on what your symptoms are, you can connect with your insurance provider. And they can tell you who specializes in what in your area, or the area that you would like to see someone. But Psychology Today is one of the main ones. There's also therapyforblackgirls.com, therapyforblackmen.org, goodtherapy.org for individuals who don't have insurance or have insurance, but mental health is not a part of their plan. There's also a site called openpathcollective.org that a lot of individuals will use because they don't charge you more than $60 for a session. I think the lowest payment is $30. And so that's the negotiated rate that you two come to. And so I think that finding a good therapist and a good Christian therapist may be similar to looking for a job sometimes. You gotta really do the work and don't give up after the first disappointed phone call, because you may call someone and say they look great on the screen, but you may also find that they're full. And so don't stop, just keep trying until you connect with the right person. But also, if you do connect with a clinician and you find that they are 100% full at that time, ask them if they can refer you to someone. And so I have a lot of people that will ask me, hey, I'm calling you back. The person that you gave me, they're not seeing, they're not taking anyone. Can you give me another recommendation? And I actually will do that. And so just keep looking, but those are a few of the resources, and just utilize that filter. And you can put in Christian, you can put in your insurance, you can put in your location. You can also put if you want a female clinician or a male clinician.
So can you, Sharon, just kind of give that? I'm going to try to type that in the chat. If you can give that, those websites that you mentioned again.
Sure. Psychologytoday.com, goodtherapy.org, I believe it is, therapyforblackgirls.com, therapyforblackmen.org, and whatever you don't catch, I'll type in as well. And also Open Path Collective. Just about a month ago, Taraji P. Henson, her foundation, the Boris Henson Foundation, they actually started a directory. It's actually been a little over a month or two, but they started paying for services for individuals who do not have insurance. And so if you are in need of services, that's also another resource. And if you're also in certain areas, there are agencies or core service agencies that can also assist you with coverage.
I would just add to what Sharon said that when you are able to connect with a clinician, if they're accepting clients, many of us will do a brief 10 or 15-minute consultation with you over the phone that you don't have to pay for, to just get a sense of, is this someone who would be a good fit for me? And so I've often had people in that consultation ask me outright, okay, I'm a Christian and I need to talk about being a Christian. Can you do that? And I love that question because it's very important for people to advocate for themselves and say, this is what I need. So you can also just ask the person a few questions to try to get a sense of if you think that person will be a good fit for you. Also, when you go to that first session, ask as many questions as you need to ask to feel like you are comfortable with that person and you can get a sense of how they work, because it's not just about the therapist telling you what to do. It's also about you feeling like this is a person who you can be comfortable with and share your journey with.
And so, Jessica, can you share what some of those questions might be? And I guess this is for anyone. If I was going and I was trying to assess whether or not this is a relationship that's going to work for me, what kind of things might I ask?
Sure. So the first thing I would ask is related to whatever your presenting concern is. Presenting concern is just our clinical way of saying kind of what you feel like is wrong. And so related to whatever that concern is this a specialty for that person, or is this something they feel like they can work with? Another question I might ask is something like how they integrate faith or Christianity into the therapy process. I might ask a question like, what kind of therapist are you? Many of us have what we call a theoretical orientation, which is basically what we believe about the way people grow and change and develop, and what we believe about how people get better. And so, for instance, a popular type of therapy is CBT, cognitive behavioral therapy. So a cognitive behavioral therapist focuses heavily on thoughts and how your thoughts influence your behaviors and emotions. And then the therapy is really on adjusting negative thoughts, versus someone who is an interpersonal therapist might be more focused on your relationships and how your relationships impact your mental health status. It's not that we don't do it all, but we have sort of different entry points, is the way I would describe it. And so it's almost like, if you pick up an album and you listen to the first song, you're like, okay, I think this is good. I think I'll listen to the rest of this track. Like, that's kind of how it is with your therapist, right? You want to get a sense of how you think it will be to give you information about whether you want to learn more and whether you want to interact with this person more. I think another important question to ask a therapist is, how will I know when I've gotten better? Or like, how do we decide how things are progressing, right? Because many of us come into therapy with the end goal in mind, right? I have this specific goal, or I have this feeling that I want to either have or to go away. And so you want the therapist to be able to help you to understand how the two of you will navigate that growth process together as well, and how you'll figure out how much progress you're making, what that progress looks like.
I'll also add to that, Dr. Jessica highlighted a lot of the important areas, so I'm only going to add a few. One is looking at homework. A lot of individuals will often think that they're coming into therapy just to kind of vent and get things out. And so a lot of times they will also ask, will I get homework? Or will you give me things to do in between sessions so that I can, practice? And so when I hear that question, I actually get excited because it lets me know that they're invested in the process to do the work. It's not just coming into the session and processing, and then you leave out and keep doing the same old thing. And so that's where the CBT, or the cognitive behavioral therapy piece, comes into play, because you're talking about putting it into practice. If you think differently, then your behavior starts to change. And so we're helping them to do that. But some of just the other minor but very important questions are, what is your availability? And so are you able to give me a standing appointment, something that I can, commit to weekly, or am I going to have to call every week? I know for some individuals, they don't provide standing appointments. I think that's something that is important in order to provide continuity for clients, and also to give them an opportunity to fully commit to their treatment process. And so I think that is important. Also, what do you take my insurance? I always hope that that's the first question, because you don't want to get too deep into all of those other things. And then you find that that individual does not take your insurance. And now you're feeling like you just unloaded all of this information onto this individual, and then you can't connect with them. Even though you felt like you did connect with them, you can't continue and schedule. So that may be one of the first questions as well. You know, do you take my insurance? Like Dr. Jessica said, you know, do you specialize in what I'm actually dealing with right now? And all, you know, how soon can I get in? Do you take weekend hours? And so those are just some of the things that come to mind. That's why I said it really is like looking for a job. You have to ask a lot of questions.
Right, right. And so as we're talking about wellness and we're talking about kind of holistic health and wellness, how important, or do you think it's important that even as someone is coming to you, that they are also seeing their physician or meeting with their pastor or their whoever is kind of working with them on a spiritual level? Or do we see this as kind of a partnership, a both and, or talk about that? And then I'm going to be quiet, I promise.
No, you're not.
We don't believe you, but it's okay.
They're good questions.
It's good.
That's good. I think I wanted to speak about that because I was going to share, you know, when I think my wife is probably online as well. But when we decided to get married, my pastor is a trained counselor. But I said to my wife, I said, you know what? Let's go to somebody totally different because, you know, I've been with him for a couple of years. He knows me, I knows him. You know, we talk chaplaincy, we talk on a deeper level and stuff like that. I want to make sure that I'm committing myself to the process and not just going through, you know. So I'm not cutting against Christian counselor because I really believe in it. But if you're doing therapy, find a therapist. If you want pastoral care, go to your pastor. That's how I see. So like you're talking about the connection, pastor. I think it's important that a person knows what they want and how to get what they want from the different people. As pastors, I know that oftentimes we kind of like operate as the whole thing. Like as a pastor, people come to you for everything. You know, you need to tell them about the bush that they need to boil to cure something, or they need to tell them about, you know, but truly a person needs to know where the boundaries lies. And I think a pastor needs to know where the boundary lies as well with that person. So if a person is talking to me, which I get a lot of times, people come to me and they want to talk, and I know it's totally out of my realm, right? I'm like, okay, here's where I make a referral. This is not for me. You need to go talk to. And I think it's the same thing should be with a therapist. There's no way you're gonna give a person spiritual, you know, guidances if, especially you're not to where that person is.
Yeah. Well, thank you.
I would say, oh,
go ahead.
yeah, I was just going to speak directly to the question of the holistic piece. So when people come for their first appointment with me, I ask them, when was your last physical? And if I know that they are a person of faith, you know, I have people who are atheists, agnostics, kind of the broad range. But especially if they've come to me like through a referral from a pastor or something like that, then one of the things I ask in that first session is, tell me about how you're connecting with your faith community, right? And so part of the discussion in terms of our coping skills might be, okay, let's work on having some personal devotional time for 10 minutes, 3 times a week. Or let's see if you can get to Bible study twice this month, right? And so once I know that someone at least has a goal of being connected in that way, then it does become integrated into the coping skills we're identifying and the way they're looking at their symptoms. And likewise, if you haven't had a physical in a year or so, I want you to at least schedule that physical before you come to see me the next time, because we have to rule out medical issues that could be related to some of the symptoms you're experiencing. So if somebody's coming in and they have digestive issues, I don't know if it's IBS or if it's anxiety. The only way to do that is to have a physical provider check you out and a mental health provider check you out. And then we can really ascertain what the issue is.
Yeah. Thank you all for that. Before we go on to the next question, I would just remind the participants to type your questions in the Q&A section of the Zoom link so we can see. I see a couple of questions that are in the chat, so we're having a little difficulty following them, but if you can type them into the Q&A section, we'll try to get to them. But I do see a question that's kind of related to what we're talking about now. And it's kind of going to the question of shame, in particularly in the faith community. How do you, if you feel like you need to see a therapist, or you feel like you might even have some mental challenges, whether it's anxiety, depression, or whatever it might be, how do you get past those feelings of shame to take that next step and seek help?
I think you have to think about you. You have to show up for you. That's my encouragement to you. I know we often are impacted greatly by what other people think and their opinions. We live in a society where social media is, it heavily weighs on people's perceptions of themselves and how they should function in life. But when it comes to seeking help, and you know that there is something that you need to address, this is really the time to show up for yourself. And so take that leap, you know, even if it's just a small seed of courage, go for it and connect with that individual so that, you know, because it's not about anyone else. No one else is going to take that step for you. But if you know that it's something that you need and it's paramount for that moment, you know, go ahead and go forward and do it with courage. Like I said, I see therapists who will often make statements like, you know, I should know what to do, or I should know how to handle this, or I should not be here. I'm so ashamed that I'm sitting on this couch. And I'm going, why? You're not exempt from life. There are things that we experience that are going to impact us. And so you're here because you're looking for strategies and you're trying to identify how to pull that stuff out of you. Like Lynval and Dr. Jessica said, you know, we're helping you get to that place where you can see the answers within yourself. And so take that step and don't allow anyone else to shame you.
Yeah, thank you.
I speak earlier, you know, about hope. Because in a situation like this person needs hope, right? But somehow they're not hopeful in themselves. So how can you get help if you're not hopeful? And that's where I think Pastor asked a question, which we have spoken to. We need a community, right? And so I really think that it's important for us as a community to normalize things. And I think I've heard most of us have talked about this. Normalize things in a way that if a person in your church has a mental illness, they will know it's a safe place for them to come and speak about it.
Yeah.
Otherwise, they're not going to. And they don't have the hope. I'm sorry, I'm getting passionate about this. They don't have the hope to go on their own because the community already shut them down. Now, you know, if my mom just diagnosed with cancer, right? And breast cancer, and when I shared at church, you know, people are like, oh, I'm so sorry to hear, you know, the breakdown and stuff like that. But if I should say she had a mental illness, probably one of the first things that they do is start laughing, maybe depending on how she's acting and stuff like that. I'm saying we as a community have to stop that now. We have to nip that in the bud. And we have to create safe, comforting environment where these people, even though it's shameful enough to come and announce this, will feel comfortable doing it because, one, they will not be judged. Two, people will respect what they have just shared. And three, professional help will be sought, whether through your pastor or through whoever is in charge of this at your church. But it's critically important that we are demonstrating this upfront by normalizing this, and don't weed anybody out, but make sure that we're making everyone comfortable enough to speak when something is happening to them.
Yeah. So that's good. So we hear about, or we talked about a little bit about normalizing, particularly mental illness, and I guess now you're talking about creating a safe space. So how practically do we do that, and what does that look like in our churches?
I think it starts with leadership. It starts with people in the community who are willing to, just as Lynval was saying, talk about their experiences. One of the things that I do anytime I do a consultation at a church is mention somehow, just as Sharon did earlier, that I have a therapist. It's not because I really want people to know that I have a therapist. That's, it's confidential for a reason, but it's because I don't look like somebody who's quote unquote crazy. And so what I've done in that moment is to say, this isn't just for the people who are acting erratically or who seem like they don't have it all together, but this is something that all of us can experience. And so that normalization process really just starts with information and contact with people who are willing to talk about their experiences. This is not telling everybody all your dirty secrets. You don't have to share the details, but even just to say, yeah, I've struggled sometimes, or I know what depression feels like. In churches, there are stories in the Bible of folks who are dealing with depression, who are dealing with suicidal ideation, who are dealing with anxiety. And in all of those situations, support is provided, right? Elijah goes into a cave and says, essentially, kill me now, right? And God comes and says, okay, here's some food, rest for 40 days, and then I'll come back, right? And so we actually have biblical stories that can help us to make these struggles come to life. So it's not this abstract thing. It's also, May is Mental Health Awareness Month. We can have bulletin boards. We can have programs like this. If 1 in 5 people meet criteria for a diagnosis, okay, there's 5 of us here on the call right now, right?
One of us.
One of us. Right? If it's 10 people in a church meeting, 2 of those folks, right? So it's not other people over there. It's us right here. And the more we can get that information out, the easier it will be for us to begin to have those conversations in authentic ways.
Can I just add to that? I just wanted to add language. Perception and language is another way to make sure that things are safe. I've been in environments where I can be cashing out at a store and something can be happening over near the entrance and someone is kind of making a scene and the cashier can say, yeah, it's one of those days, those people. And I use that as an opportunity to say, what do you mean those people? And I just, before I know it, I'm educating them on mental illness and how not to shame that individual for being symptomatic or having a mental illness, and that we need to be concerned about them. And so I'll look over, make sure it's being handled, but I'm also talking to that person. So I look for opportunities. If someone's saying, yeah, she's just acting crazy again, let's try not to use that statement.
Yeah.
And they'll go, why? It sounds like she's having a difficult day today. And maybe she needs some support. So let's be mindful of how we categorize how people are managing things in life. And so be really careful with your language. That's what creates safe languages. And so I think that it's very helpful when you are mindful of what it is you do and when you have an opportunity to share with others. And this is not judging anyone. So you also got to be mindful that after you take that mental health first aid class that Lynval was sharing with you, you should take it. I'm telling you, you should take it. It is extremely helpful. But one of the things that happens is that you may find a person who then says, you shouldn't say, don't say that, that's wrong. And they get upset because they're really passionate about it. use it as a teachable moment, remain calm, don't beat them up. Remember, you just took the class on Saturday, it's okay. And just, you know, really help them kind of make that transition so that they can be kind to someone that may be going through something. And then you yourself, you're also learning to be more kind and extending grace and support to those individuals in need.
As you speak about leading from the front, Sharon, you know, I always think of this story, Mark chapter 5. There was this man just up in the mountain. He was so strong, and he's cutting himself, and he's doing all of these things. And, you know, we call him the demon-possessed man, right? One thing that was so potent in this story to me is how Jesus dealt with it. Jesus literally walked towards the man as he ran towards him, right? If we talk about leadership here, and we're talking about meeting on middle ground, but it's like that person trying to get to you, but you're always away from them, that it's not going to happen. It is not going to happen. And I believe that in any stories in the Bible you look at, it's actually a teachable moment for us. God embraced this man. He embraced him as a human being. I think that's the big picture we're missing sometimes when we see people who have mental illness. We don't understand the orientation and what's happening with them internally. But if we could only see them as a human being, that first, then the mental thing becomes a second-hand nature. And you deal with what you know first, how to deal with. And that's how to care for a human being.
Well, thank you for that. I think what you said is that definitely on point in just seeing each other as humans and seeing each other as being created in the image of God, which helps us to kind of normalize this whole idea of an illness that we cannot see, but it's something that's going on inside of the person. And it's just as real as any other illness that we may have. And I don't see any more questions. Pastor, do you have any more questions before I ask each of them to give any final parting words?
Well, you know, I always have questions I could ask, but I won't. But I always just simply say, as you're wrapping up, I do want to just thank everyone again. I'm not sure I'll get another opportunity to do that, but do want to thank you once again for sharing tonight. This is a significant issue, and it I guess that it's brought to fore during this quarantine, but we know that it's not something that simply comes as a result of our current situation. And just so that I can say it plainly for those who are watching that may be at Clifton Park, and I've said this in a lot of different contexts, that I just believe that that as we are created as unified beings, and as just as all of us know that we are supposed to be getting our physical bodies checked, it just makes sense to me that as the Lord created us as mind, body, and spirit, that we ought to be checking our whole self to ensure that we are healthy and well. And so I appreciate all that has been shared. I appreciate certainly as well the sentiment that that as we're talking about mental health and mental wellness, that we are recognizing that it is a part of our holistic and integrated selves, and so that we all have a role to play in this. And so certainly I'm encouraging anybody who is feeling any kind of stress, that you just feel like, you know, that something is not right. You know, I am available to you. Certainly we involve the entire community of faith, which includes people that the Lord raises up to be clinicians, to be biblical counselors, to be physicians that he's raised up within the body of Christ, people that he has equipped and gifted for this work. And so I'm encouraging it. And I believe the Lord desires it. He desires that we are well. And so I really encourage it. And again, just thank you all for your time on this evening. And so I'm going to mute myself and I'm going to step away so that I don't ask any more questions. So I will say good night to everybody.
Okay.
Thank you, Cheryl, as well.
Thank you, Pastor. Thank you for jumping in and rescuing us from the technical difficulties. So before we close out, I would like to give each of you just an opportunity to share any just kind of final words or parting words that you would like folks to take away from our time together this evening. And I think we started with Lynval. We'll end with Dr. Jessica, or we'll start now with Dr. Jessica, and we'll just kind of go through.
Okay, so I just want to say, kudos to all of you for joining the conversation, because that means you have a vested interest in this process. What I would leave you with is that God intends for us to live full, healthy lives. And that means attending to and honoring all of the different parts of ourselves, that whatever part feels out of whack or undone, God has a process for us to heal that. Whether it's going to see a therapist, whether it's re-engaging in a faith community, whether it's connecting with our social support. And so I just encourage all of us to really look at ourselves as holistic beings and honor all of those parts of ourselves equally.
Yeah. Amen.
I second that, and definitely add that this is a great time for the believers to truly find yourself in the Word, find out who you connect with, who has a clear depiction of what life is like for you, and see if you can actually work on improving and getting to that place of resolving whatever concerns you may have, having the courage to push through and get to the end of that victory. And so I just want to encourage you again. I know I keep saying this, and I kept saying this throughout the 2 hours, almost 2 hours, is that this really is a time to show up for yourself. Again, it's not selfish. It is so that you can allow others to get the overflow and the benefit of what comes from you. But it is important that you show up for yourself so that you can be whole emotionally, spiritually, and physically. And so as we're in this time of transition and change, make sure you just kind of keep some things in perspective, understand the importance of mental health, and be able to pivot. Allow yourself to be flexible as you grow in all of these areas. And so I just encourage you to keep moving forward and make that phone call.
Mm-hmm.
Of course, I'm grateful, sincerely grateful for this opportunity, Cheryl, and of course, all the panelists. I'm super grateful, and I'm really, really excited about mental health. Simply because as I said before, I think this is the least that Jesus talks about, the least of these. And how I have this quote from President Bill Clinton, actually. He says, mental health illness is nothing to be ashamed of, but stigma and bias shames us all. Mm-hmm. It's such a powerful quote. And why is this stigma and bias is shaming us? It's because somehow we all haven't gotten it yet to understand that this is something real. When someone is going through, for instance, an anxiety attack, we don't understand how real this is to this person. And because we don't understand, we're not compassionate, we're not empathetic, and we let these people down. Yeah. I am just saying to us tonight, the way we can help each other and help ourselves is really by normalizing things, making sure that we're not making people look like they're different or calling them out. In fact, one of the big thing here is we're not labeling people. We're not diagnosing people, by the way. I'm not Dr. Jessica or Sharon, so I can't diagnose you, but I can help you. And that's how recovery becomes possible. when all of us chime in and become a part of this. Thank you guys so much.
Well, I want to say thank you all for participating tonight. You've really been a blessing to the body of Christ for just for your service, and certainly want to thank all of the participants who joined the call. We are grateful to have you, and hopefully that you have some things that you can take away on tonight. Whether it's just to just be strong mentally, emotionally, and things that you can do practically. And as well, if you or a loved one have a mental illness, is how to love each other through that. And I think one of the, I think it's Pastor Phillips on the chat said something about seeing the person first before you see the condition. So that's how we love one another through this, is seeing the person, supporting each other through all of this. So we're going to close out with a word of prayer. I don't know if Minister Henley is still on the line. I was trying to look through the chat to see if I saw her still on the line. If you are there, Minister Henley, if you can unmute yourself and close us out in a word of prayer.
Cheryl, I don't think she can do that on this format of the call.
Oh, she cannot. Okay.
No.
Okay. So, Pastor, would you like to close us out?
I can.
Okay.
All right, let's look to the Lord together. Gracious God, we do give you thanks once again for bringing us together on tonight. We're thankful, Lord, that we've been reminded all night long that our creation was your idea, and that you had intention and deliberation and when you did it. And that your desire is that we would live life, and not just live it, but live it abundantly and in a place of wellness. And so, Lord, we just lift ourselves to you, just asking, Master, that you would continue to allow us to be introspective and to search ourselves, and where we might find ourselves lacking or in need. We're grateful that you've raised up a community of believers to come alongside of us in this journey of life, that your word tells us that no matter what we have faced, we're not facing it alone, and neither are we the only ones to have ever faced it. And so, Master, as we journey with you, we're grateful for your word that says we can be confident of this very thing, that you has begun this good work in us, will complete it until the day of Christ Jesus. So we thank you for the panelists. We thank you for all that has been said. We ask that you would bless the remainder of this night. And we ask for your joy and your peace until you allow us to come together again. And we ask it in Jesus' name. Amen.
Amen. Amen. Thank you, and good night, all.
Thank you.
Thank you.
Have a blessed evening.
Good night.
Good night.
Bye.